Tracey, you're the owner and founder of IBS Clinics and a nutritionist, so a lot of people will be coming to see a nutritionist for the first time. Can you just explain to me a little bit about the training that you've gone through and your history as a nutritionist, please?
Yeah, absolutely. Like many nutritionists and like many of my colleagues, I started nutrition for my own personal interest. I spent 10 years being quite overweight, and as a young teenager I suffered intermittently with irritable bowel syndrome. And then latterly, actually, as I just started my nutrition training, my mum was diagnosed with inflammatory bowel disease and had colitis. So I had some very personal interests in being a nutritionist. And I started a science foundation course in 2002 for BCNH, the UK College of Nutrition and Health. And then I subsequently went on for a 3.5-year course on nutritional therapy to learn to be a clinical nutritionist.
Okay, and so just give a little bit background on what it is that you actually learn and before you come into practice.
You start out, I think the training's a little bit different now, but certainly in the 3 years that I did it, the first year was foundational. It was anatomy, physiology, pathology, and then the subsequent years, the second and third and half of the following year, was based on looking at syndromes. So we looked at things like metabolic syndrome, we looked into in-depth kind of diabetes type conditions, we looked more at irritable bowel, we looked at a lot more kind of functional stuff. And then obviously getting into working directly with patients, understanding how to convey the message to them, getting all of the information, all the finer points of all the diets that you're likely to use, when you would use them, why you would use them, getting your head around the tests that are available, and again, when you would use them, why you would use them, and then getting into sort of nutritional supplementation, vitamins, minerals, and other kind of herbal type things that can be helpful sometimes when you're working with complex cases.
And I assume at the end of all of that there's quite a stringent exam process to go through.
Yeah, it's pretty tough. You go through a number of case studies. In the time when I was doing the qualification, I had 18 case studies to submit, which was quite some feat throughout the year. And additionally, some very intensive nutritional exams as well in order to be able to qualify.
And I imagine it doesn't stop there, you carry on training and things develop, so a little bit about what you've done post-qualifying.
Yeah, absolutely. Once you qualify, in order to maintain your qualification as a nutritional therapist, you have to do what they call CPD hours. So you have to do 30 CPD hours every year in order to be able to maintain your accreditation. And
CPD meaning?
Continued professional development.
Mm-hmm.
And I think that going on courses and keeping up to date and being cutting edge is very, very important. And so I have always more than exceeded the 30 hours. And in fact, last year I clocked up over 150 hours of CPD, and largely actually because I'm pursuing an additional accreditation in functional medicine.
Okay, so functional medicine, I know, having spoken to you before, that you're one of the very few practitioners in the UK to adopt this functional medicine approach. Just explain a little bit about what that means.
Yes, I'm on a pathway with the Institute for Functional Medicine based in the United States, and I'm one of, if I qualify fully in April next year by sitting their big exam, I will be only one of 1.5% of the practitioners globally that will have got the accreditation. But what functional medicine means and what it means for me and my patients is that functional medicine is about being very sort of patient-centred in my approach. So everything is about the patient, it's working with the patient, it's making sure that the patient not only knows what is going on but is fully participating in their care. And it's using a holistic approach because no body condition involves a single organ, because the body doesn't work that way. So if, for example, if I was working with a thyroid issue, conventional medicine might just say if you're hypothyroid that you would just be given a thyroid medication, so you'd just be given thyroxine. In functional medicine, you look at why the thyroid's not working properly, and you might look at things like nutritional deficiencies. So is the person very deficient in vitamin A, which means their receptors don't work? Are they not able to convert thyroxine into its active form because they don't have enough selenium? Or is it possible that that conversion is being blocked by stress and their cortisol levels are too high? So I very much look at the whole 360 degrees of the person's entire body, because that's the way that everything works. And I look to address every single aspect in order to return that person to, a proper health.
So IFM is big in the US, if I'm right in saying
It
that.
is, yeah.
And it's embraced by more than nutritionists. It kind of covers off the whole spectrum of the medical.
Yeah, I mean, it's increasingly, when I go to those symposium, it's quite often the case that there will be 12 to 1,500 people in the room, and 3/4 of them will be doctors or equivalent in the United States. Increasingly now there's a band of Brits that are over there as well, and again a lot of British doctors are interested and are pursuing this type of work,
Okay.
type of certification rather.
That's impressive stuff. So anybody that coming to see you can rest assured that you've been through a thorough background and continue to develop your skills in this area, and it's all just in the interest of the patient ultimately.
I'm absolutely passionate about being the best that I possibly can be, and what I believe about functional medicine is it's just so logical to look at all the underlying factors to somebody's health condition and understand that when somebody presents with seemingly unrelated conditions, they often are very related indeed, and all I have to do is figure out the points that of commonality and address those, and hopefully the person will improve.
Great, well thank you for sharing your background and your knowledge and where it came from, and we look forward to speaking to you again soon.